So at the 2025 ASCO Gastrointestinal Cancer Symposium, we saw several groundbreaking and practice-changing abstracts. So the first abstract that we want to talk about is the BREAKWATER abstract. Now we know that BRAF V600E mutations are present in somewhere between 5 to 10% of our patients with metastatic colorectal cancer. Why this is such an important subset is that patients with BRAF V600E mutations have a significantly worse prognosis than our standard patients with metastatic colorectal cancer. And there is an FDA-approved targeted therapy regimen in the refractory setting for patients with BRAF V600E metastatic colorectal cancer, which is encorafenib and cetuximab. So Breakwater looked at bringing these targeted therapies into the frontline setting. So this was a study of FOLFOX plus encorafenib plus cetuximab versus standard of care chemotherapy in patients with BRAF V600E mutated metastatic colorectal cancer. Now, the outcomes of this study are fairly early, but this is a practice-changing abstract because the overall response rate was roughly 61% in the FOLFOX plus encorafenib plus cetuximab arm versus just 40% in the standard of care arm. The interim overall survival analysis was fairly immature, but at 12 months, the overall survival in the treatment arm that included encorafenib and cetuximab was about 80%, and this was only 66% in the standard of care treatment arm. When you look at the treatment-related adverse events, we think about adding in targeted therapy to chemotherapy. Will there be a lot more adverse events? And the answer is they're relatively the same. But of course, the main difference is that rash was seen in about 25% of the patients in the treatment arm, which included encorafenib and cetuximab, versus the standard of care arm. So really, the bottom line from the Breakwater trial is that there's now an FDA-approved frontline regimen for patients with BRAF V600E mutated metastatic colorectal cancer, and that is FOLFOX in combination with encorafenib and cetuximab. And the recommendation from this abstract is that all patients should receive this combination if they're eligible for those treatments.